Some women or couples might not want to have a baby now. It is still possible to enjoy sex without getting pregnant by using contraception methods. Contraception methods are things you can use or do to reduce the chance of getting pregnant when having sex. There are many options. Let's talk about some of these in more detail. Condoms. Male condoms are a type of thin rubber tube that covers the penis. You can buy them at your local supermarket. Female condoms are a type of thin rubber-like tube that can be inserted into the vagina. They are harder to find. They are available from family planning clinics, some chemists, and the internet. Condoms help to avoid pregnancy by trapping something called sperm, that is the white fluid from the penis, so that it does not touch the inside of the vagina. Condoms can protect you from getting an infection during sex called sexually transmissible infections or STIs. IUD. IUD stands for intrauterine device. There are two types of IUD. Hormonal IUD contains a hormone in a small piece of plastic. It can last for 5 years. The copper IUD contains copper, a type of metal, instead of hormones. It can last for 5 to 10 years. IUDs are inserted in the uterus and can be removed by a string by a specially trained doctor or nurse. You shouldn't be able to feel it during sex because the string is cut short. You can get an IUD by talking to your doctor. Contraceptive implant. The implant is a small soft plastic stick containing a hormone. It is inserted in the skin of your arm by a doctor or nurse. It can last for 3 years. Depot injection. Depot injection is a hormone fluid injected into your bottom or arm muscle. It can last for 12 weeks. Contraceptive pills. Contraceptive pills are medications containing safe chemicals called hormones that need to be taken every day. There are two types available for women. The mini pill has 28 tablets containing one hormone. The combined pill usually has 21 tablets containing 2 hormones and 7 sugar tablets. Talk to your doctor about which medication would be the best option for you. You can still get pregnant if you stop taking the medication. Vaginal ring. Vaginal ring is a small soft ring that contains 2 hormones. It can last for 3 weeks inside the vagina. A woman's period and mood can change when using hormone methods. Speak to your doctor about side effects and for more advice. Diaphragms. Diaphragms are a cup-shaped material that sit inside the vagina, covering the opening of the uterus. The uterus is sometimes called the womb. It is best to have a doctor or nurse check that it is put in properly. These can be bought at the chemist. They do not protect against STIs. Natural family planning. Some people use phone apps or a calendar to help them judge the days they are less likely to get pregnant when having sex. It is hard to get it right because everyone is different and you need a really good understanding of your body. Speak to your doctor about where you can get more information. This method is not as reliable as using condoms, the diaphragm, hormonal contraception, or copper IUD. Withdrawal method. The withdrawal method is when the penis is pulled out from the vagina before any fluid is released. But it can be hard to control because even if a little fluid touched the vagina, it is still possible to get pregnant. This method is not as reliable as using condoms, the diaphragm, hormonal contraception, or using copper IUD. Emergency contraception. Emergency contraception, also called the morning after pill, is used if other methods have failed and you are worried you might get pregnant. It can be bought at a chemist and needs to be taken as soon as possible after sex. It can work for 4 to 5 days after sex. Copper IUD can also be used as emergency contraception. Speak to your doctor about your options. Permanent method. The permanent method involves surgery for men and women who don't ever plan on having kids. For men, the surgery involves cutting small tubes inside their body to stop the sperm from leaving his body. For women, the surgery involves clipping or putting a coil on small tubes inside her body to stop the egg from moving into the womb. These are not a good option if you plan on having kids. If you liked this video, watch our other videos on how pregnancy begins and what are periods.